Anemia with MPN-associated myelofibrosis is a common problem, and really, one anemia I think occurs for a range of reasons in myelofibrosis. The first is the marrow dysfunction. The marrow has the fibrosis; it's just not producing enough cells. Two, the spleen can be significantly enlarged and can be holding on to too many cells or really destroying them prematurely. And then three, the medications that we use can induce more anemia. So ruxolitinib as a JAK inhibitor is a very helpful therapy, but the creation of red cells is dependent on JAK2. So when we inhibit JAK2, it's a predictable outcome that we develop anemia. So anemia has several contributors, if you would. Patients with myelofibrosis, similarly have kind of baseline anemia they might have associated with the disease, as well as they certainly can have, drug-associated anemia, when they take a new therapy. So all of those are contributors as we assess anemia in myelofibrosis. So in terms of anemia here, there's many different levels of data being presented. Everything from the data from my group looking at the impact of contribution of blood counts on the symptoms and how anemia can worsen those symptoms. New agents that are in development. Sotatercept was presented at the novel therapy trial for myelofibrosis, showing activity in those group of patients. And on that basis, a very similar agent, luspatercept, is going to be tested in a clinical trial. So a lot of different things that are being evaluated, both in terms of new therapies, better understanding of the anemia, as well as other agents that continue to be in development, but are not directly necessarily being presented here at ASH, but are looming large. Fedratinib, another JAK2 inhibitor that recently has come off clinical hold and may have some benefit in anemia. NS018 that has some activity in anemia. We presented at ASCO earlier this year momelotinib that has activity in anemia for myelofibrosis. So a variety of different things out there, but again remains probably one of the greatest unmet needs.